yourself, please. Just
Oh, sure.
each person
Chris
that
Baker,
talks.
KTLK Radio. There are issues and problems. My listeners, their biggest question is, how can they trust government in the Senate, the Congress, whatever you want to call it? How can they trust them to come up with an effective change in health care in the United States of America? When the option of when a public option is discussed, I keep hearing that it's going to be nonprofit and that the taxpayer will not subsidize it. If that public option can't meet its obligations to people who are in it, then where are they going to get the money?
Well, it's designed to have to do what every other nonprofit insurance company does. As you know, every health insurance company in Minnesota is nonprofit. That's one of the reasons that Minnesota is a leader in the country. I'll give you a statistic. In Minnesota, 90 cents out of every dollar that's sent to insurance companies goes to health care. In the rest of the country, it's 70 to 80% in every other state. So what it turns out is that actually non-profit is much cheaper. So because the public option won't have to make a profit, and because they can do other kinds of efficiencies, this will actually put pressure on private companies, which after all have been driving up. We are in a crisis now. We're in a crisis, and the crisis has been caused by the escalation in the cost of health care. So those people who are running around saying, oh my God, this is going to be a government takeover of health care, what do we have now? We have private health care which won't cover people with pre-existing conditions. We have private health care in which more than half of the bankruptcies in this country are caused by health care crises. And 80% of those people who go bankrupt with a health care crisis, well, they have insurance. So what we have now is absolutely unacceptable. And if we just continue the way that we're going, our healthcare costs are just going to keep escalating. And the whole point of the public option is to give one option to folks in the gateway so that they can choose among a whole bunch of different private options and one public option, just like I get to do, essentially, as a senator.
But how can, first of all, given past...
Would you like to say something?
Sure. I think one thing I'd like you to tell your listeners is when healthcare consumers are surveyed about their customer satisfaction, the two programs at the very top of the list are Medicare and the VA, both government-run public plans.
But are they, the question is, though, are they running efficiently? And that's what the concern is.
Absolutely.
And
if you look at Medicare, the administrative costs are 3%. You look at the private industry, it's as high as 26%.
And the VA provides wonderful care.
Well, I'm a disabled vet, so I've had quite a bit of experience with the VA, and I would differ on some of that, but that's just a personal thing. My question is,
well,
given...
You would differ with the vast majority of folks who get their health through the VA. The VA is rated very, very high among people who get their health through the VA.
Okay,
and
well,
they do it very efficiently.
Sure.
And so that's the reason that Medicare has solvency problems is that health care has just escalated in this country.
Which
and
brings...
health care has escalated in this country because we've done nothing to reform it.
Well, Senator, I don't disagree that it needs to be looked at, but still I go back to my original question. What is it that the public should look at to trust government to reform health care?
Well, look, we just came off of 8 years of the Bush administration, and I don't blame people for not trusting the federal government. But it seems to me that the Bush administration sort of followed in the pattern of folks who said that government is the problem. They got elected, and then they did everything they could to prove it. So this is what makes this is difficult, is because of the behavior of the Bush administration in the Iraq War, in Katrina. They made it harder to do this. They turned a record surplus into a record deficit.
Well, now we're in a whole different debate. I go back to my original question.
Can I ask you a question?
Well, no, in fact, that was an answer to your question, which is why don't people trust the government?
Can't,
We need to
well,
let some other folks answer.
We'll go to the next question.